Dear students, today in this video we'll learn about errors of refraction. Before moving on to errors of refraction, you need to understand two terms, emmetropia and ametropia. First, what is emmetropia? When the rays of light which is coming from an object are properly focused onto the retina, the eye is called an emmetropic eye. In simple words, this is a normal eye where the refractive power is normal. What is ametropia? So if the light rays are not focused exactly on the retina, the condition is said to be ametropia, meaning the patient has errors of refraction. So in this case, the image may be formed in front of the retina, or it may be formed behind the retina, or it may be unevenly forming on the retina. So the important types of ametropia are myopia, hypermetropia, anisometropia, and astigmatism. Now let us understand myopia. Myopia is also called short-sightedness or nearsightedness. Here, the person can see the near objects clearly, but the distant objects appear blurred. As the term tells here, it is nearsightedness. He can see only what is very close to his eye. For example, the student sitting in the back bench may sometimes complain that they cannot clearly see what is written on the board. Why does this happen now? Why he is not able to see what is written on the board clearly is because in myopia, remember, the eyeball is elongated. That means the anteroposterior diameter of the eyeball is increased. Because of this increased length, the light rays are focused in front of the retina, but not on the retina directly. Another reason can be there can be increased curvature of the lens. Here what you see the diagram here on the left side is the curvature of the lens is normal and the light rays are properly focused onto the retina. But when the curvature increases, meaning the bending increases, the light rays are focused in front of the retina. So this can happen if either an increase in the curvature of the cornea or the lens itself. So there are three reasons for myopia. One is when there is an increase in anteroposterior diameter of the eyeball or increase in the curvature of the lens or cornea. Now, how do we correct it? We use a biconcave lens, okay? Because when we use a biconcave lens, the lens will divert the light rays slightly and then it will help it focus properly onto the retina. So, in some patients also keratoplasty can be done. It's a surgical procedure, okay? In the